Hi all, very good morning to all of you. I'm Sheeram and I have written a bestseller recently which is called AI for Everyone and also another bestseller called Cybersecurity for Everyone. I'm also a policy think tank member for Sri Chandrababu Naidu. Prior to that, I was country head in EY, and while I was country head in EY, I was advising 10 state governments on startup policy, economic development. And just a few days back, I had met Sri Chinnababu Garu. So I'm thankful to Yashoda. I'm thankful to Chinnababu Garu for this opportunity. And he told me about this event. And I asked, hey, I am not actually a doctor in terms of like, the who an MBBS, a person who can work in oncology. So he said, no, what you can do is, you can come and you can talk about being in AI for almost like close to a decade now and advising 10 state governments. You can tell us like, how to think about equitable, cancer care that we can talk about. And I felt, yeah, that's a good opportunity to talk because, if we talk about, the cancer care, it is a situation where we are in today that we say 15 million, 1.5 million people in India, they suffer cancer. Now that's the number that we officially know. But if we think about real numbers, they are going to be much, much, much bigger than that. And if we think about 1.5 million and giving India's population in billion, it's really, we are talking about 1% more than 1% of the population. But that's the population of entire Bahrain. So we are saying that we have a suffering Bahrain living in India, and we really don't have answers to cure them, all of them. And now, if we talk about, I was talking to one of the news channels sometime back, and we were discussing in that, when India got its independence, at that point in time, it happened like nobody wanted to become Prime Minister of India. The situation was so bad, and at that point in time, Nehru was pushing in like, even the first three policy plans that we make 5-year plans, we want equitable plan. I don't want certain sections of India that to really grow fast and certain sections in India that have not grown fast. But over last 67, 70 years, what we have seen is like, that we have got two countries living, India and Bharat. And if we talk in terms of, our, legacy of being living in India or of our prayers, so if we, even thousands of years back, we used to say, Dehi mein saubhagyam arogyam, Dehi mein paramam sukham. These are lines from Durga Saptashati, which is actually written few thousands of years back. So in India, if we are talking about India, if you're talking about a country, the first and foremost thing that we should be able to give is not only a quality education, food, but a proper health care. And we are talking about it from thousands of years, not just starting today. So now from that perspective, how does AI come into the play and how artificial intelligence and policymaking can come together to help us here? So from that perspective, we say, around 70% of population in India, which is like, that we see that only 30% of population is living in big cities and they get a good cancer care. How about people living in, the cities which are, or small towns where people, where it is like, you even don't know that you suffer from cancer. Most of the cancer detections are actually happening in a very later stage and very less chances to save this kind of people. I was talking to Policy Bazaar and to Mr. Rajiv there, who's CEO, and I was being told that, majority of India is just one cancer away from being bankrupt. So means as an individual, everybody does not have that kind of a money in the wallet to take care of a cancer expense that is going to come. So from that perspective, why can't we think like, especially startup, certain kind of challenges that we have is to think, how AI and oncology can come together, what we can do to democratize the knowledge so that we can save people across India. We need not think about, whether this person can actually afford an AI care or not. And from thinking from that, from a policy perspective, I feel that, there are four pillars that we need to talk about. The first pillar is certainly talking about investing in R&D. Second is to come up with a national strategy. Third thing that we should think about is, fostering PPP, that is public-private partnerships. And then what kind of skills do we require? If we can think from these angles, we'll be actually in a position to think and prepare country better when we have to take care from or think about equitable measures for cancer.